good afternoon to COVID scientists and warriors. All together, we welcome you to the second learning webinar series of Global COVID Network, which was launched last week by Sambodhi Research and Communication Organization, the Indian Social Responsibility Network, New Delhi, and the University of Washington, Seattle. Today, we also have the senior officials of the two co-sponsor agencies, Mr. Sudhanshu Malhotra, who is the Vice President of Sambodhi, and Mr. Santosh Gupta, who is CEO of Indian Social Responsibility Network, which is a grassroots network of people working in the health sector in India. So the second webinar that we are going to start now is on epidemic preparedness and mounting responses to COVID. Today, we will have the second speaker address some of those strong variables, such as the economic integration and travel integration between geographies in terms of transmission speed of COVID. All the speakers in the first webinar had emphasized on global partnership to share lessons and technical information. Today, we are pleased to welcome our esteemed colleague, Dr. Xiao-Nong Zhou. He is Professor Director of National Institute of Parasitic Diseases at the Centers for Disease Control and Prevention of China, and his two colleagues, Dr. Ning Xiao and Dr. Shan Xiao, also to present the Chinese experience and the preparedness of COVID epidemic.
Thank you so much, Dr. Hira, and thank you so much for your invitation to participate in this webinar. And this network already been done very good webinar than this second one. So we are happy to be participating in this one. And today I would like to present the lessons learned from the battle against the COVID-19 in China. So my presentation are going to be three subjects. One is the general scenario, and the second one, what kind of lesson we learned. And third one, we did a small study on the transmission patterns and recovery from the COVID-19 in China. So I will present the first part, and my two colleagues will present another two parts. So goes to the first part, general scenario of the fighting against the COVID-19 in China. So all of you can see these figures. You can see the blue color is the local cases we reported since the end of the last year, and you will see the curve, and really it's fit well to the some infectious disease curve. And the red color is or you can say the second wave, which are imported cases after the start from beginning of the February. So up to the 28th of April, a total of 8,200 and 858 reported cases was reported, and more than 7,700 individuals was recovered from the treatment, and about 4,633 people was died of the COVID-19. So when you calculate the accrual case fatality rate, that was 5.6%. And you can see the curve reduced very quickly because of our strong intervention or containment countermeasure really effectively. So that's why the number of the cases is this new reported cases reduced every day. But the imported cases started from the beginning of February, and then later is here from the later of March. Most of cases are imported cases in red color, so you can see here. But in recently, we also find the asymptomatic infections. So totally about so now we can see what's kind of our containment measures we did. So this combine those contain strategy, including the social mobilization and the personal protective measures with hand hygiene and masking wearing. Mask wearing, we thought this is very, very important, particularly when people gathering together. And if you wear the mask, it really help you for you protect yourself. Also, you protect your if you are patient, you will spread to the others. So and avoiding the gathering and keep the social distancing also very, very important. So all the because in the beginning of the outbreaks, it is in the Chinese New Year festival. So all the activities about the Chinese New Year activities stop. Even the hotel and even the restaurant, because everybody want to involve this battle and keep the social distance. And but for our medical doctor and our public health workers, we are working on the mainly 4 early, and one is early detection. Second one is early diagnosis. Third one is early isolation for the quarantine, and the fourth one is early treatment. And also for the epicenter in Wuhan, they locked down the city, so the movement restriction was happened almost for 3 months in the epicenter. But for the other cities around the country, only maybe around the 2 months. And particularly during the outbreaks for the hospital, we focus a lot on the prevention and control of the nosocomial infection. This in the hospital, we have to do a lot of work on this. And also environmental measures, we are routine cleaning, and so some insecticides also be used in the surrounding environment. So these are containment measures.
It's my honor to join these meetings. It's a very important meetings. So first, as I mentioned by Dr. Zhou, there's several key experience we had in China. So let's move to some parts. I will give more details. First is lesson 1 is so all the infectious diseases control, we have at least basically the principle is the same: early detection, early isolation, early report, and early treat. So first, we want to know some of the definition of the case. In China, we classed the case into the suspect case and confirmed cases. So of course, for the asymptomatic individuals and the contact is some of them is potential infectious resource, so we must take care. First, I want to mention is the case definitions in China. Suspected cases to have to meet the two criteria. One is the epidemiologic histories. The second is the clinic symptom. So it's very important, but it's not confirmed because without the evidence of passaging, we cannot make these confirmed cases. So the move to the second part is suspect cases plus the passaging confirmed. We use the RT-PCR. If positive, we confirm. Or the viral gene sequence is highly homologous to the know the virus is also confirmed. And the third is newly it be used as a criteria for the IgM specific and IgG detectable, or the specific IgG is reach the titles of at least 4-fold increasing during the convalescence compared with the acute phases. So for the second is not really reporting, but it's a very important issue is contact. How to trace and manage is very important. So for this contact searchings, multi-sector cooperation is very important, like public health securities, authorities, and the many departments should be involved to searching, to find the contacts. This contact is must within the several days, they contact the case, confirmed cases, or the suspect cases. How to find, how to tracing. So CDC, as you know, in China, CDC have played a very important role to respond for the investigation to find the close contact. It looks like the detectives, so should be carefully to find any clue to tracking, to tracing the contact. And the contacts under the quarantine, usually at home or at a designated place like a hotel for at least 14 days for the last contact with the case or the symptomatic individuals. So temperature and the symptoms should be monitored twice a day. Usually outdoor activities not allowed.
To have such an opportunity to introduce our some modeling and prediction works. As you know, since the city lockdowns in Wuhan, our modeling teams start to work together to make some predictions for the future academic dynamics, and also we try to evaluate the possible impact and about the society's resumption, such as the school closure or go back to the workplaces. Now here, I would like to introduce some of our preliminary results, and these results and the methods and all of the details you can to follow this reference on the bottom of this screen. In this study, in our early study, we mainly focus on 3 key questions. The first, we want to know what's the risk and trends of disease transmissions in different regions, because you know in China, the cities, they all have their different characteristics. The second question, we focused on how to evaluate the effectiveness of the intervention strategies. The third one is we want to know what will be happens when the school resumptions go back, or the peoples go back to their workplaces, whether or not there will be the second outbreaks, or what, and also about the economic loss if this city lockdown continues. Okay, next slide. Okay. In order to do so, we have adopted age-specific disease modeling works. Here you can see we have divided the populations into 7 age groups. For each age groups, they have some special social characters, such as they are whether or not they are the school students, or whether or not they are working or stay at home or something. So. And also we have integrated 4 social settings. We believe that the disease transmission may occur in the social settings, such as their household, people are close contacts with each other in the household, and also the schools, including the colleges and universities. It's also a lot of people are gathered together. And it's a physical workplace and public communities on public places. So in our model, we have, you can see age and social siting. Based on this model siting, we have utilized the demographical census data. By applying some computational methods, we can estimate the contact frequencies between different age groups, and also the contact frequencies among these age groups in different social settings. You can see some detailed mathematical descriptions in our paper.
Good evening, gentlemen in China, and good afternoon in Africa. Here is what the current situation is like. There is a lot of data available currently. Either a processed data from Johns Hopkins University, or advanced models from the Singapore University, or even a lot of I'm very happy to say a lot of the people working in the social sector have crowdfunded together to put up portals to give data about what's going on. There are almost hourly updates on many of the portals like Worldometers or COVID-19 org.india. There's a lot of hourly updates available. Now, we do not come from the medical science fraternity, but from the sheer perspective of analysis for people who are more or less, data enthusiasts. What would you actually look at? So one thing that obviously first comes to your mind is the deaths per test. Deaths, actually, what is the number of deaths? Now, if you're actually trying to even work out in a refined way that not every country or not every state has been equally tested, then you would like to look at a metric which is death per test, which is the mortality metric. Now, that's the chart we have on the left-hand side. And if you look at it, it's got a fair sprinkling of countries. That's which are a fair mix. They're not easy to classify or do a pattern classification on them. So you have Algeria on the top with 6.76 in the deaths per unit tests conducted. This is into 100, by the way. I just want to give the disclaimer. It's not that 6 are dying for every test. It's into 100. This number is a percentage number. And you have Belgium at the 4th place. The most common herd of European countries, which are in news for a large number of coronavirus infection cases, and a large stress on their medical systems. UK and France, they come at the 7th and the 8th position. Again, you have Brazil down at the 14th, 15th, you have Ecuador. Now, the key is, how do you actually go about saying that you would like to have a more structured way of looking at your data? So one way to look at it is, say, cases per million. Yeah. If you rank, now this is the data that we had as of the 3rd of May in the evening. Okay. If you look at the cases per million, you have San Marino at the top. And of course, we've just taken the first 15 or 16 positions to get a larger perspective of data. You have USA at the 14th position, Italy 15th, and Switzerland at the 16th position. Now, this gives some idea. Cases per million is a good metric which gives some idea about the whys of the spread, not just the hows, but the whys of the spread, like sort of. So if you look at San Marino, it's like a small enclave, almost surrounded on all sides by Italy. It's a very popular tourist destination. You go down, Spain is again popular for tourism. From Belgium onwards to Isle of Man, right until Switzerland, from the 10th to the 16th position, you have a great deal of economic engagement with the world, either in terms of the financial engagement or corporate structures that have companies over there. So you get into more of a sense of understanding that the infection, the spread of the infection, if we look with an appropriate metric like cases per million was actually driven by this economic and travel integration. Okay. And we just quickly go down to the next slide. So now the key is, how do you actually ascertain which are the factors that are impacting the spread? I mean, if we were to say that, give us a sort of statistical multiple that, if I take factor A and I, collect some data for factor A, well, that makes one part of the story. If I collect some data on factor B, which makes another part of the story, then, what we say in simple statistical language is, can I multiply probability of infection due to factor A and probability of infection due to factor B, and then try and get a score, or can I get a rank which will say how infected a particular region or state will be. So at our end, we actually tried to identify about 4 issues which we felt were the key issues that were, sort of impacting the spread. So one was economic and travel integration, international economic and travel integration of that particular nation. The other was also internal integration. In India, we found that even internal economic integration was to a great extent impacting the spread. The population densities, especially in urban areas. And fourth, what is the social infrastructure available to implement social distancing? Is the urban structure there, or the societal structure there capable of handling social distancing? So on these 4 factors, we tried to get some initial sense of an estimate.
It's time now to put a few closing remarks quickly. Thanks, of course, to both the speakers, our colleagues who have really shared information and made it much more impactful for us now to move on to the 3rd webinar that will be held next week, same time on 12th May. And that will be on diagnostic and testing.